And with that, I'd like to call the Health and Human Services Committee hearing to order. Madam Clerk, please call the roll.
Alderwoman Ingrassia.
Present.
Alderwoman Tyus. Alderwoman Tyus, you're muted. Alderwoman Green.
Present.
Alderwoman Martin.
Present.
Alderwoman Navarro.
Present.
Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Spencer.
Present. With that, we not only have a quorum, we have perfect attendance. I'd like to take a minute to review last meeting's minutes. I'll entertain a motion to approve those.
So moved.
Second.
With that, Madam Clerk, please call the roll.
Alderwoman Ingrassia.
Aye.
Alderwoman Tyus.
Aye.
Alderwoman Green.
Aye.
Alderwoman Martin.
Aye.
Alderwoman Navarro.
Aye.
Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Spencer.
Aye.
9 aye votes.
Okay, and with that, I want to mention too, we have a couple of other guests here that I see in the participants log, but are not speakers here. The reason I'm pointing this out, we have Dr. Fred Eccles, Janine Arraghi of the Health Department, a couple others that I think we may, Michelle Bildner, that we want to give the ability and the opportunity to weigh in. Because as you know, the first order of business here on our agenda here is to have Cristina Garmendia, the architect and author of the Racial Equity Indicators Report, give us an update, some of the indicators that she was able to research and update for us here today. So if there's a way we could make sure that some of those folks, if they want to be able to weigh in, I know we would welcome their input, be able to be moved over as hosts. As the chair of what's emerging as one of the most important committees, I would say, overseeing policies related to health in our city, I know myself and members of the committee here are committed to making racial equity a primary area of focus for health policy for the city of St. Louis. You know, I think the outrage that we all feel in the wake of some of the many injustices that we've seen across our country, you know, this is a sharp reminder of the huge amount of work we have to do as a nation and certainly as a city. And with that, I'd really like to commend Cristina Garmendia for the work that she has done providing this, the Racial Equity Indicators Report several years ago, and to coming along with us here today as a volunteer to update through her own research and on her own time some of the indicators that relate to health within that indicators report. This is very important work, very timely, and of course we're very grateful for the work you've put into this, Cristina. And with that, I'd like to turn it over to you to kind of give us an overview of what the report is. We all know it was prepared by Cristina when she was with the city of St. Louis in a partnership with Ford through Ferguson, the United Way of Greater St. Louis, with the financial support of the Rockefeller Foundation. And although Cristina is no longer with the city of St. Louis, her work has continued, as I mentioned, as a volunteer, and is incredibly impactful. Cristina, can we do a mic check real quick?
Yes, can you hear me?
I can, great.
Okay, great.
With that, I'd like to turn it over to Cristina and make sure that some of the other folks, the health department especially, are able to join us as panelists here.
Thank you, Chairwoman. So I'm going to share my screen, and so I will Let's see, this one should work. And I'm gonna be trying to put it on presentation mode. Okay. So can everyone see my screen?
You can.
Okay, great. Thank you so much. So what I have prepared for you today is an update as well as some thoughts on how the equity indicators can be used to help prioritize the work of this committee. I now, yes, as Chairwoman described, I was based in the mayor's office for 13 months to prepare this baseline report with the intention that this report is a baseline and should be and could be replicated in years to come to monitor change in equity outcomes over time. So what I wanted to cover today was give some background to around the equity indicators in case it's been a while since you've seen it or read about it. Talk specifically about how indicators were selected for health in the health area. I wanted to summarize the findings that were related to health and human services, as well as go through some prioritization of how that could support committee members choosing an area of focus or priority for this committee. Followed by new data for the indicators that I could update, and then put into context a little bit how the city's is in the scale of the region in terms of racial equity, and then finally some action items. So as described, Equity Indicators was a project that was in collaboration with several other organizations, Forward Through Ferguson United Way. I was based in the city in part to get better access to data that could provide more context and more specificity around equity. My goal was to design a framework of indicators, so provide some quantitative goals related to the calls to action from the Ferguson Commission, so that we could measure progress towards achieving greater equity in St. Louis over time. And so the outcome was a policy tool that could be used by a number of groups that now lives on the city website. This also is a standalone report at stlouis-mo.gov/equity, followed by, and I wanted to also mention the United Way's effort to expand the equity indicators for the entire region is online in the form of a dashboard, and that's at stlequity.org. And that was, just to note, that was released late last year. So the overall approach that I took to this effort was that it was centered on the calls to action in the Ferguson Commission report because of all the work that the whole entire community put into establishing those priorities and those action steps. Part of my role was to identify the available data. So the data that was used for this report came from the Missouri Department of Health and Human Services, with state level data, federal level data from the census through the American Community Survey tool, as well as city departments, health, human services, and the police department. And throughout the process of putting together choosing the indicators and doing the analysis and writing the report, major stakeholders were consulted. So at the time, it was the director of the health department was Melba Moore. The Missouri Foundation for Health was consulted, as well as Dr. Jason Purnell from Washington University in St. Louis, and a handful of other organizations. So the equity indicators really hopes to quantify racial equity through looking at racial disparities. So what that means is differences between resident outcomes by race. And the indicators were selected based on a combination of, does it reflect the priorities of the different stakeholders, including the Ferguson Commission, the data that's available to us, and meaningful metrics that talk about racial disparities. And so what resulted there's a total of 72 indicators in the entire report, and the ones that ended up in the health and safety section are a total of 8, including infant mortality, health insurance, violent crime victimization, homelessness, pedestrian injuries, chronic disease, ER visits, women's health, and mortality rate. And this represents an effort to provide a comprehensive, broad-ranging definition of health, and as well, health metrics that appear in the other topic areas of the report include, the majority of which appear in the child well-being section, which is one of our worst scoring sections, where we have the most racial disparities and the worst outcomes, include child food insecurity, child lead poisoning, child asthma, youth STD rates, access to healthy food, access to parks, and then use of force is included in this section, in the policing section. And so I'll give a brief update about that as well. So what's missing? Just something I note throughout the report is what indicators we weren't able to include that are important. And so a lot of the reasons why these important indicators were included in the health section is because the data isn't available in the form that we need. And we know, a lot of the shortcomings of health data is that it shows us what's able to be collected. So we know more about ER visits than we do about preventative healthcare. Just because of that's how the data is collected is when someone encounters a system like the hospital. So there are a lot of important topics where there's less data available, including mental health, substance abuse. And so I'm going to run through the overall findings of the baseline report. Black residents in the city of St. Louis are more likely to lack access to the tools that support health. So that includes health insurance, housing, safe places to walk and play. And Black residents were more likely to be uninsured and more likely to experience homelessness. And they're more likely to be killed or injured while walking. That's the pedestrian injuries indicator. Black residents are more likely to suffer from health problems that are a product of their environment. Black children are more likely to have asthma and lead poisoning. Black adults are more likely to develop chronic diseases that can't be prevented by vaccines and cannot be cured by medicine. Black residents are more likely to suffer from violence in St. Louis. The most common reason for Black women in St. Louis to visit hospitals is for treatment of injuries caused by assault. And Black residents are significantly more likely to be victims of violent crime. And police are more likely to use force in majority Black communities. These are the facts. Black residents are more likely to die at every age, including infants. And this is a result of a lot of correlated and complicated issues, including the social determinants of health, which are the conditions in the places where people live, learn, work, and play. So with that overview, I wanted to focus on four ways that the committee can prioritize their focus with equity in mind. First off, we'll be looking at equity score, the numbers, and followed by numbers of people impacted, the ability of the city to take direct action, and places where long-term commitment is needed, where the leadership of members of the Board of Aldermen can be useful. So first, equity score. This is the easiest one to talk about. This is the focus of the report, was giving a score to all these different diverse issues. And coming at the top for, if you were going to focus your efforts based on the largest racial disparities, you would be choosing or looking at child asthma and youth STD rates. As a reminder, the equity score is the lower it is, the worse the racial disparity. So a 1 is, for example, what does the score of a 1 mean? Black children are more than 10 times as likely as white children to visit emergency rooms for asthma-related complications. So every time there's a score of a 1, it's more than a 10 times difference. Compared to 100, 100 is there's no racial disparity at all. I wanted to include a little bit of current events in here to put into context. The city has been publishing the data for COVID-19 case and death rates disaggregated by race, which is great because it allows us to put it in context with the equity indicators. And so if you were to give the COVID-19 case rate a score, an equity score, it would be a score of a 38. So it would put it number 10 on this list. And if there's ever any confusion about what the equity scores mean, there's a conversion table in the back of the report that converts any racial disparity ratio to the score. And so what is the racial disparity for the COVID-19 case rate? Black residents are currently between 2 or 3 times as likely as white residents to be diagnosed with coronavirus. And so this is the rest of those health indicators ordered by equity score. Another way to prioritize using the equity indicators is looking at the largest number of residents that are impacted. So this is a slide I put together for the legislation committee last year, and but I've highlighted the ones that are related to health. By far, the lacking health insurance is something that impacts a lot of residents in St. Louis. Followed by another way for the committee to select priorities is choosing equity indicators where the city has more control, where they have a more direct ability to take direct action through policy or programs. And so I've highlighted a few here: child lead poisoning, homelessness, child asthma, pedestrian injuries, and use of force. I'm going to go in depth on some of these a little bit later. And then the last strategy you could use is thinking about what are the equity indicators where we need a long-term leadership commitment. And so this is work that must be done in coalition, and it's the most complex and long-term. So, and that includes a lot of these mortality indicators that are more, they summarize all of the impact of all these disparities on Black residents of St. Louis. All right, so next I'm going to be going through a series of equity updates, starting with mortality rate. So the data that was published in the 2018 report came from a few years earlier. So back then, Black residents were 34% more likely to die in 2016 than white residents. Now, in 2018, using 2018 data, the most up-to-date data that's available, is that Black residents are 47% more likely to die in a single year. So that means the equity score decreased. So it went closer to 1. It went from 68 to 62. And this is a result, this increase in racial disparities is a result of a couple different things. There was an 8% decrease in white mortality rate. That's good news. But it was combined with a small 0.5% increase in Black mortality rate. So the gap between the two groups widened. And in the original report, mortality rate was disaggregated by disease type. I didn't have the time to do every single disease type for you guys here today, plus we don't have time, but in the original report, the leading causes were, for all, both Black and white residents, was heart disease, cancer, and unintentional injuries. But Black residents are significantly more likely than white residents to die of homicide, death by injury by firearm, kidney disease, and diabetes. Again, I wanted to put the current crisis, the coronavirus crisis, into context with this data. So using the death rate disaggregated by race that was provided by the city, I'm going to put it in context with the other most common causes of mortality. For white residents, coronavirus is currently sitting right between stroke and accidental poisoning. So it would be the 7th most common cause of death if these causes stay relatively stable. Compared for Black residents, it's the number 4. So it's between lung cancer and unintentional injuries. So it's much more common for Black residents to die from a coronavirus than a lot of other causes in the past. So the next equity updates on child lead poisoning. So at the time of publication, Black children under 6 were 1.7 times more likely than white children to be diagnosed with lead poisoning. Now, that disparity has significantly increased. It's doubled in just 2 years. So Black children are 3 times more likely than white children to be diagnosed with lead poisoning. One caveat is this indicator used I would say a lower standard of lead poisoning. Right now, the standard is, I don't know actually how to say the word, so we'll go to the health department for that, but the standard has increased for deciding whether someone's been poisoned by lead. So there's more children that are considered lead poisoned now than there were in the past, because the standards have changed. All right. But one thing I wanted to note about this indicator is that it's a function of who is tested, and right now universal testing of children in this age group is recommended. So every child in this age group should be tested because of the age of city buildings and a few other factors. But testing rates have continued to drop over time. So right now, we, as of 2018, we were only able to test 44% of children in this age group. And what that means is 2,000 less children were tested in 2018 than in 2016. So this is an area that the city has direct control over. They provide a lot of the testing efforts. And I wanted to highlight that the health department puts together really great, more focused reports that just aggregate this data by geographic location. And so we know that there are some wards that have a much higher risk of lead poisoning than others. Wards 20, 21, 1, 4, and 9. And so what does the city have to do with lead poisoning directly? Demolitions. And so there's been a lot more attention in the press on the effect demolitions have on lead poisoning. So a few articles, examples of lead spread that's happening right now in the city. And that's because there's less, we have regulations, right, where that to prevent lead spread during demolitions, but it's not effective enough to prevent demolition contractors from following the standards required to protect our children. Next equity update, youth STD rates. So then Black youth aged 15 to 19 were nearly 10 times more likely than white youth to be diagnosed with chlamydia. That's the same case now. One reason why the equity indicator is hard to change is because it uses data that's from a rolling 10-year average. But we have some good news. STD rates are decreased for both white and Black youth between 2017 and 2018. Bad news is because the STD rate for Black youth fell more slowly, the racial disparity grew slightly between 2016 and 2018. So the other updates I have for you guys, infant mortality, new data is out, but there's been no change. Black babies are still 3 times as likely as white babies to die before their first birthday. For health insurance, we had a decrease. So here's the bright spot in terms of racial disparities is that there was a decrease in racial disparities between 2016 and 2018 for health insurance. And what that means is Black residents are still nearly twice as likely as white residents to lack health insurance. So that's about 13.6% of Black residents are uninsured compared to 7.7% of white residents. So the equity score increased from 40 to 50. Another bit of good news is the count. The count of uninsured Black residents fell by nearly 2,000, while the count of uninsured, and the bad news, the other half of that is bad news, which is white residents that were uninsured increased by over 1,000. And if we're thinking about right now, the odds of the number of people who are uninsured increasing is quite high due to the recession and people losing employment and employer-sponsored healthcare. So there was a few indicators that I wasn't able to provide updates on. So the Department of Health and Senior Services has the data, but hasn't made it publicly available for ER visits, which is something that's used for the child ER visit indicator, the child asthma indicator, and the chronic disease ER visit indicator. Then also, this police department, they were a source of data for pedestrian injuries and violent crime victimization, as well as use of force. They haven't proactively published any new data. So this is data that needs to be requested, and I did not do that for today. And Human Services has not proactively published data disaggregated by race around homelessness. And I wanted to spend another minute on use of force. Officers report use of force incidents nearly 3 times as often in majority Black neighborhoods as in majority white neighborhoods. There's a few things wrong with this sentence, and I want you to think about what it might be. The first thing is officers report. So our use of force data is a function of whether officers report it happening. 2, I used, this is a data or an indicator I had to work to include in the report, even though the data is not the right kind of data. It's not the right kind of data because it's place-based. It's not disaggregated by race. So the data, I was only able to get it by neighborhood. So you're seeing this a proxy, neighborhood is a proxy for race, and that's not quite right for use of force. So that's all a function because prior to 2018, use of force incidents were not reported for all suspects, but rather if incidents occurred in conjunction with injury of an officer in the course of duty. So our use of force data was very officer-centric, not suspect or resident-centric. And the city revised its use of force reporting system in 2018, and they pledged to be able to provide the race of suspects in future reports. So they have not proactively published that data. I don't know the exact reporting system they're using. I think it might be called Blue Team, but they piloted and started collecting data in the way that it is needed to be collected to really talk about this issue. So that's something that this committee and the Board of Aldermen should request the police department to share. Okay, so briefly, I want to introduce everyone to the Regional Equity Dashboard and by looking at health and safety. So overall, the city of St. Louis has the most substantial health disparities in the region compared to the surrounding counties, St. Louis County, St. Charles County, and St. Clair. So we have the lowest score, which means the most disparities. So there's a few differences between the city and the regional equity indicators I wanted to highlight. So in the city equity indicator report, the underlined violent crime victimization and pedestrian injuries, that was something we were able to do because we had access to police department data. The regional equity indicators did not have that level of access, so they replaced those indicators with ones that were available to them from state data, so preventable hospitalizations and injury hospitalizations. So I wanted to highlight that there's differences, but the regional equity indicators is comparing apples to apples across all of the counties. And same thing for child well-being. We had juvenile referrals to court, and they replaced that with low birth weight because they didn't have access to all the court data that we did, and they had access to health state level data like low birth weight. So in comparison to the region, St. Louis City has less racial disparities than the region in the following short list: child food insecurity, child lead poisoning, and homelessness. It doesn't mean that we have less of these issues. It just means the racial disparity, the differences between Black and white outcomes is smaller. However, St. Louis City has greater racial disparities than the region in a long list, mostly related to hospitalizations and ER visits. And one thing I want to note about this is hospitalization data and ER visit data is not, it is city residents. So it's residents of the city that go to the hospital. It's not collecting data based on whether the hospital is in the St. Louis City footprint or the county. So it follows the resident wherever they may end up being hospitalized. So I just wanted to be sure to share that. And so I wanted to take a brief look at one of the indicators, homelessness, from the regional equity indicator dashboard. So here you can see we have the best score of all the surrounding counties. Well, St. Clair County has the worst racial disparities in homelessness. And just a reminder, homelessness really measures the rate of that residents receive emergency housing services from service providers funded by that department. So, and what that means is if you look at the city versus the region, so for the entire region, almost 6,400 people received emergency housing in 2016. The city alone provided more than 6,000 of those residents with services. So St. Louis City is providing the majority emergency housing services for the entire region, which if you're working in this area is no surprise. But, and that's why their rates of emergency housing recipients per 1,000 residents is so much lower. And I think it would be, it'd be worth your time to review the regional equity indicators for the other health indicators, just to get a picture of where the city stands in terms of racial disparities, how much it takes the burden of providing services related to these issues. But I didn't want to take up all the time by looking at all of that. So I wanted to highlight a couple of the Ferguson Commission calls to action that touch on the most highest priority equity indicators in health and human services. First one is establish school-based health centers and trauma-informed schools, because that would address child asthma, which is one of our most inequitable indicators, child-led poisoning, which has had the largest increase in inequity in just 2 years, and youth STD rates, again, one of the most inequitable issues. And followed by increasing health insurance coverage and access. Obviously, it would impact health insurance. So this would be Medicaid related. And then obviously, if you have health insurance, you're less likely to need ER visits for preventative care. So most of the Ferguson Commission calls to action are not radical. They're really common sense calls to action. So, and in the report for each of these indicators, I list the related calls to action. Action items. So this is the last section. And first off, I want to commend the health department for caring deeply about racial equity and embedding it into a lot of their work. When I participated in the strategic planning process, one of the recommendations I had for the health department was that they be more activists, or not activists is the right word, but bother other departments that have health impacts that they're not aware of. So such as the building division and demolitions. And so the health department has adopted something called a health in all policies model. So what that means and what this might mean for this committee is that if you are working in public health, you need to be involved in a lot more than just health department related issues, but also building division, police department, and so on. And so an action item for this committee is for a member of this committee to join the Demos and Public Health Task Force that's led by Michelle Bellner of the health department. And so while that task force has just been started, I wanted to preview some potential recommendations they might have, just so you get a sense of what that might mean. So that might mean that they recommend hiring more inspectors in the building division to provide active surveillance of demolitions. It could mean increasing the fines or redistributing work from demolition companies that aren't following protective measures. Next action item is more general. So we should request updated data for the health-related equity indicators that I wasn't able to update for you because I don't have access, the same kind of access as I did when I worked for the city. Then we should apply a racial equity lens to all policy proposals. And what that means is we need to be looking at the data and evidence to be collected and analyzed, disaggregate it by race. So you can understand the differences and policy might have on different populations of the city. And then lastly, we should create and fund more groups focused on eliminating racial disparities in health. And our shining example in the St. Louis region is Flourish SCL, which is an initiative of Generate Health. They have an explicit goal of 0 racial disparities in infant mortality by 2033. And that means they're working very interdisciplinary. They're working with MoDOT on transportation issues. They're working with a variety of partners to address all the potential causes for racial disparities in this issue. So with that, I wanted to cede my time. Thank you.
Thank you so much, Cristina. I think we've seen this report before. The update is incredibly impactful, seeing how these indicators have changed over time. But the action items at the end, I think, are also incredibly important. We have read the report and we have failed to really address what should come out of it. And so from this moment, I think this committee should make a commitment to following through on all the action items that you have outlined here as a starting point for how we should be using the report that you've put together, starting with having this committee request for updates of that data so that all the indicators that you've reviewed can be updated, requesting that the police department share the use of force data that we do collect, having a presence from this committee on the vacancy task force, and then a commitment from the Health and Human Services Policy Committee of the St. Louis Board of Aldermen to reviewing all actions, all policies that we review and propose as a committee through a racial equity lens. As a starting point, the Health and Human Services Committee, I will be asking each member to commit to all those things as a result. I'd like to turn over to the committee for some questions for you, but before we do that, can you tell us when, just as a reminder, when the Racial Equity Indicators report was originally presented to the city?
So the report was released in January of 2019.
And you were on staff in the city for how long to write this report?
November of 2018. I don't know. It's been a while, but it was yeah. So it's November 2017, then through January. Literally, the day the report came out was my last day.
Has the city formally engaged you in any way since you completed that work on how to move forward and use this work in a constructive and productive manner?
No, and all the efforts by the community organizations to have me present to community groups, that was not supported by the city at all. So if anyone's seen this presentation or versions of this presentation, it's because of efforts of community groups and not specifically the city.
Well, we are incredibly grateful for your work, and we will be using it as a committee, as a guidepost for how we should be moving forward. With that, I'd like to turn it over to the members of the committee to ask you follow-up questions. Starting with, I'll go in order of seniority here. Alderwoman Ingrassia.
Thank you, Madam Chair, and thank you, Cristina, for joining us today. I don't have any questions. Just again, want to thank you for the incredible work that you did on this, and then also spending your own time to update it. It was a huge mistake and a very big disappointment of mine that you were let go from the city. We are very good in the city of St. Louis at coming up with plans or reports and then putting them on a shelf and doing nothing with them. So the fact that you're able to spend time with us today without being employed to do so is very appreciated. And Madam Chair, I'm definitely committed to moving forward the action items listed.
Thank you, Alderwoman Ingrassia. Alderwoman Tyus. I don't see if Alderwoman Tyus is still with us. Moving on, we can come back to her. Alderwoman Green.
I'm just going to echo what Alderwoman Ingrassia said, that, thank you so much for work, not just when you were at the city, but also the continued advocacy of keeping this report alive and updated and continuing to see its presence in the media. And I also want to thank our chairwoman for bringing this before us today and, working with all of us on the committee to make sure that we're drafting a plan to go forward to address the items that are in here and get some real policy solutions in place. So thank you for your labor of love on this because you don't have to do this and you are. And I think that, that speaks volumes and a lot of us really appreciate it.
Alderwoman Martin.
Sorry, not used to being on my iPad. Again, thank you so much. And I also appreciate how this is broken down in just a very simple way to read all the statistics. I have one question about the lead testing. What do you think has contributed to the breakdown and the change in just the drop off in kids getting tested for lead?
I know the health department has some theories about this. A lot of the testing is occurring in physician offices, and there might be some disagreement by physicians to require testing. It's all voluntary. And right now,
I did that. Yeah. Okay.
Yeah, and right now the health department is working on increasing testing in schools and making testing available in schools, which would reach a lot more kids and in early childhood and centers and daycares. So I'll defer to them on more discussion of those issues.
Okay. And then just maybe the answer to this tonight, or I could ask later, but obviously the state recommends, the Commission on Lead Poisoning recommends every child get tested. Is there, the state's recommending that, but there's no mandate, I guess, obviously from the state, even though the commission is, okay. All right. Thank you so much. This was a really great presentation, albeit depressing matters. So thank you, Madam Chairwoman.
Alderwoman Rice, or excuse me, Alderwoman Navarro.
Okay, thank you. I just want to share in my colleagues' gratitude to both you, Cristina, for all of this work and for updating it, and then also to the chairwoman for making sure to keep this information in front of us. So thank you. I don't have any questions at this time.
Alderwoman Middlebrook.
I have no questions, but thank you, Cristina, for all of your work on this report. This was awesome. Thank you.
Alderwoman Rice.
Thank you. Echoing all of the gratitude again, Madam Chair, for bringing your calls to action for us as a committee as well. And I fully support those. And thank you, Cristina, for all of your work getting this done. And the updates are alarming. I think that the lead number jumps out as something particularly really dangerous, as we know that vacant homes are dangerous, like vacant buildings are dangerous, but the rapid pace with which we are demolishing buildings and what we're releasing into the air and water and soil as we do that, I think is very alarming. And so seeing those numbers jump like that is absolutely concerning, and something that I think we should prioritize moving on. So I don't have any other questions, but would echo the request to have a copy of the presentation so that we.
Yeah.
Okay. Yep. I will be sure to send the presentation on.
Alderman Todd.
First of all, Madam Chair, thank you very much for bringing on Cristina, and thank you, Cristina, for coming. I don't have any questions.
With that, I'd like to invite any member of the health department who, I think we all know the health department has been instrumental in providing the data. They do phenomenal reporting on an annual basis and really have accomplished a lot with what little funding of the health department gets per capita. Is the director still on? I open it to either Director Eccles, Janine Arraghi, who has been an incredible asset to us throughout the years, or Michelle Bildner. Would anybody like to speak from the health department?
This is Fred Upple. So again, echoing the sentiments of the other board members. Cristina, thank you for the wonderful work that you've done to produce this document as well as to update it for this meeting. As she also mentioned during her presentation, health in all policies is an approach that the health department is taking, making sure that we incorporate health in all of our programs, but more specifically incorporating racial and health equity in all of our programs, making sure that's integrated or interwoven into every program that's implemented by the health department. There are a couple of things. The lead numbers is something that is alarming, but one of the things that happened after the Flint crisis was that CDC changed its guidelines. And so the threshold went from, I believe, 10 micrograms per deciliter to 5 micrograms per deciliter. And so when you lower that threshold, you identify more individuals that have increased risk for lead poisoning. And so that's one of the things that has resulted in an increase in the lead numbers for the city. However, still looking at the disparities that's something that's still alarming, for it to increase at such a high rate is something that we really have to pay close attention to. One of the things that COVID-19 has shed light on is, again, these disparities and inequities that we kind of talk about every day. But I believe it was Alderwoman Ingrassia's point, what are we doing? What are we going to do differently moving forward so that we properly address these issues? It's one thing to look at the data as data, but at the health department, we're looking at these as the data, as these are lives that are really being impacted. So how do we address these lives and improve the environments where these individuals are living so that, moving forward, we can put them in a better position to not only attain self-sufficiency, but also to improve their health outcomes. So all of the programs that are operating right now in the health department are working together to address these inequities. And one important point that we also take a look at, or one document that we take a look at annually, is the health outcomes, the health county rankings that's produced by the Robert Wood Johnson Foundation. And so one of the alarming statistics from that report that was published last year was health outcomes for the city of St. Louis. And so out of all 115 counties in the state of Missouri, when we looked at health outcomes, the city of St. Louis ranked 110th. So, and also knowing that we have probably more medical providers in our population than any other jurisdiction, that's still alarming. So, even after individuals have access to care, they may not be receiving quality care. So, how do we address the bias that may occur during these physician encounters? So, there's a lot of work, as Cristina mentioned, that we have to do moving forward to address the biases and the underlying root causes of the systemic and structural racism that is impacting health outcomes. And so the health department is really dedicated to doing that. But as I tell everyone on a daily basis, we cannot do it alone. And so we really rely on the support of the legislative branch of city government, which is the Board of Aldermen, to help us really work towards addressing these issues in a sustainable way, because we can't afford to put Band-Aids on it. And so putting a Band-Aid on it means that more lives will be lost without consequence, and that is not acceptable for us. And so we really are desire to really improve we desire to work more closely with the Board of Aldermen, particularly the Health and Human Services Committee, so that we can develop policies that really address some of the inequities that exist in our community. And I think we've already started doing a lot of the work. A lot of the policies that were drafted and adopted last year really helped us address some of the inequities, whether it's related to environmental health services, but there's other areas that we need to do that require some significant attention as well. So we're excited about being able to work more closely with the Health and Human Services Committee and the Board of Aldermen as a whole to really create policies that will address these structural and systemic issues.
Thank you, Dr. Eccles. And you absolutely have a working partnership here with the Health and Human Services Committee. We're all committed to working with the health department to start to better address some of these inequities. And we look forward to figuring out ways to, through policy, start to make our city a more equitable and more healthy place for all of its residents. We have Janine Arraghi and Craig Schmidt and a few others. If anybody else wants to jump in, Michelle Bildner, before we wrap this portion up. I know Janine came in as this employee of the city working on lead issues several years ago and has been a champion on that program. Janine, did you want to weigh in? Okay, with that, I would like to say, in addition to those action items, recognizing the doubling in our lead poisoning rates in our children, as well as that alarming #1 disparity issue of asthma rates. I will be calling on a subcommittee and a working group, a subcommittee of the health committee that can do a deep dive into some policies that include not only the health department, but the building division, to go through how we, as was pointed out by Cristina, are responsible as a city for having policies that greatly impact lead poisoning and asthma rates in our children. We've got a positive commitment from the commissioner of the building division to participate, as well as Janine from the health department. And we've reached out to some of our hospital systems, and we will be taking an input from this committee to make sure that we have a working group that can really help to at least start to address that. And we'll be working with the committee to follow through on those action items on some of these other indicators as well. So as committee members identify issues that they want to start working on, Alderwoman Boyd has an excellent question here in the chat. What is the plan moving forward? And we all have a role to play. And so as we move forward, we have some commitment on a volunteer basis from Cristina to be to be a resource where she can for us, so that we can start constructively working on policies as a committee that can help address these very glaring disparities in health outcomes for our city residents. And with that, I'd like to move on to the next agenda item. Dr. Eccles, we'll be hearing I believe it's a resolution. I'm so sorry. Oh, I'm realizing we have an attendee with a hand up. I don't want to be remiss on that. Craig Schmidt, do you have something? I don't know if I can help make sure, I don't know, from the technical perspective, give you the ability to talk here. Is that a possibility here? Let's see. Okay, it looks like we're having some technical difficulties, and if we need to come back to that, we can.
Alderwoman Spencer.
Yes. Oh, there we go. How are you?
This is Janine, and I have had difficulty being able to access because we're present on the YouTube Live. And so I think that might be what Craig's challenge is.
Okay. Did you have anything you'd like to add, Janine?
I'm happy to help out in whatever way I can. As you indicated, I spent many years working on the lead poisoning prevention program 10 years in the city. And then part of what we did in children's environmental health was to expand that outreach to asthma issues.
Mm-hmm.
I think I'm echoing, I apologize.
Yeah, that's okay. And Janine, I would like to commend you to, you have been an incredible asset to this committee, to each of us individually, and to the city, always being available after hours, all weekends, and in every way that you can to serve our residents. Thank you for going above and beyond for the residents of our city. With that,
sorry, this is Michelle. Can I add something in here?
Yes, please. Absolutely. Thank you, Michelle.
Thanks for having us all. And Cristina, thank you so much for your work and reminding us of how important it is to use data-driven approaches to improve public health. And also bringing up the idea of health and all policies is that it's not a programmatic effort. It is a sweeping effort to work across sectors to achieve health goals. So one example that you brought forward already was our work with SLDC and the building division on a demolition and public health task force also working as part of the Vacancy Collaborative, which has an equity indicator score of 4. So if we all remember the index being 100 being the highest, vacancy being 4 is not equitable. And so with the health department working on that strategy, we're able to align some of the health goals with demolition goals as well. And to the note on asthma and lead, something that we've re-stood up over the last 8 months is this Healthy Homes and Energy Efficiency Coalition, where we see an intersection between health, housing, and energy. So we have a few different strategies that we're developing and building out of that. Notably, though, housing being a fulcrum for health issues such as lead and asthma. And so through coalition building, and I would argue that all of this work requires coalition building, and the health department has some roles, specific roles across all these health issues, but can't do it alone. And of course, your support is also needed and warranted. But we do have some things in place, and we look forward to giving updates on that progress, and we can share out more about those meetings and our work plan and what we're doing. So just thank you so much for your time, and we look forward to collaborating.
Thank you, Michelle, and we look forward to having those updates, and maybe we can collaborate on a good time for you to give those to the committee.
Chairwoman Spencer, I think I'm on now.
Hi, Craig, how are you?
I'm good. So somehow I wasn't able to get on it originally, but I did want to assure Alderwoman Ingrassia and the rest of the committee that we enjoyed working with Cristina when she was putting this report together, and I know how hard it was for all of that to happen, but we have not given up on that report, and we constantly refer to the report. It's so very important, and I look forward to the updates that we have with regard to that. I know that there are so many things with regard to our community health improvement plan that are based on that, and the Forward Through Ferguson and some of the other reports that we have, even looking at the built environment, not only for vacancy, but just in terms of how it impacts our pedestrian injuries, a lot of the work that's going on with violent crime, in addition to the others that you've talked about. I know Annie Rice is there, Alderwoman Rice, and she did the temporary food permit efforts last year, low income, low access. So there are so many of these things that are all interrelated, not only departmentally, but in terms of the various parts of our economy and society and our health, and the need to try to have those partnerships that we're talking about throughout the community. So we have not given up on that report. It is absolutely part of what we do every day.
It's great to hear. Thank you so much, Craig. Thank you again, Cristina. Thank you for your leadership on this and your continued efforts to bring this to the forefront and keep this as a guidepost for us as policymakers to make our city a better place. I'd like to now move on to the next agenda item. We have the health department here to discuss Board Bill 14. Did I get the number right, or is it 17? Board Bill, Board Bill number 16, Resolution number 16. This should be a quick one to go through the resolution to approve the City of St. Louis Senior Citizen Services Fund. I'm not exactly sure who is here from the health department to be presenting on that, but I believe Bill Keeling is also here for that purpose as well.
Hi, I'm Jamie Opsel, and I'm the executive director for the St. Louis City Senior Fund. We're not part of city government. We're a political subdivision, very similar to the Mental Health Board and the Children's Service Fund. And I'm here to answer any questions that you all have in regards to our budget. So just to give you an understanding, the St. Louis City Senior Fund, this is our third year. And we, like I said, we're a governmental entity. We derive our authority from the Missouri Revised State Statute. And our purpose is to provide funding to persons 60 years of age and older so that they can age in community. So we are one of 55 counties in the state of Missouri that has a senior service levy fund.
Thank you, Director Opsel. So, and just to remind everyone here, the fund is funded by a tax that was passed originally by the Board of Aldermen in 2016.
The voters. Right? Yes.
So, originally by the Board of Aldermen, it went before the voters in 2016, and it was passed. Can you remind the committee what that levy is per resident, more or less, on an average basis? It was fairly small, but
it was originally 5 cents. It since then has decreased to just a little under 5 cents for $100,000 of assessed valuation for your property.
The property tax. Okay. And has the budget changed tremendously from last year's budget? I know we get this resolution every year in the Health Committee. Can you remind the committee if this the current budget has changed in any notable way from last year?
The main change that we have placed before you is we are actually increasing the amount of funding for programs and services for grants. In our first year of being a senior service fund, the funds usually come in, most of the funds come in around December, January, February timeframe, and our fiscal year ends June 30th. And so we really had just 7 months. We did start the grant process, but the grants weren't able to come out until July 1st. So we already automatically went into the second year. So our main focus this year is we are in year 1 of a 5-year plan to ramp up funding to be able to spend down the excess of that net position from year 1. And so we have been slowly increasing the amount of funding out to programs and services, to organizations to address, to implement different programs and services. In year 1, we had 17 grants. Currently, we are up to 37 grants.
Okay. And were those grant allocations sent around? Was that part of the package that was sent to the committee? I apologize, I haven't reviewed that in full.
That's okay. So our grants are focused around a needs assessment that we completed in year 1, where we surveyed older adults in the city of St. Louis, and through a mail survey of over 400 older adults. They provided us with what they felt were the most important resources to be able to age in community. Our number 1 focus is really providing resources to help people stay in their homes. So year 1, we focus on economic security programs and services, helping people get connected to resources such as the Circuit Breaker program, Missouri RX, different programs that can help increase their income, or programs and services that can decrease their expenses by getting them connected with into senior subsidized apartments. We also focused on fall prevention programs where we offer free health classes. We offer several different programs to help people with exercise and some education around fall prevention. Then we moved on and focused in year 2 on providing funding for homemaker chore services so that people can stay at home that might need extra support. And we also were focusing on social isolation prevention programs, which has actually been extremely beneficial during this COVID-19 experience.
Great.
In this coming year, we've expanded to provide oral health services. And we've also included some additional resources under exterior home maintenance programs in the different neighborhoods.
Okay. Thank you, Director Opsel. The co-sponsor of the resolution, Alderwoman Clark Hubbard, is with us. Alderwoman Clark Hubbard, did you have anything you'd like to add before we open it up to questions?
No, I just wanted to be here in full support. And again, Mr. Keeling had to jump off. Mrs. also was on here with us, but along with myself, I wanted to bring the hundreds of senior citizens in the 26th ward through Park Central, Abdullah, and Academy Sharon Park neighborhood associations that directly benefit from the services and from this fund. So I just wanted to again, be on here to support and be able to answer any questions if there were any from me as well as a co-sponsor. Thank you.
Okay, and with that, the committee has the senior budget line item for fiscal year 2021 in their mailboxes from Mary Goodman, sent yesterday afternoon for your reference. I hope you're all able to look at that online here. And with that, I'll entertain questions from the committee from either Alderwoman Clark Hubbard or Director Opel. I'll start with Alderwoman Ingrassia.
Thank you, Madam Chair. I don't have any questions. And Jamie, thank you for the work you do and for coming before us every year to explain it thoroughly. It's appreciated and valued by many of my constituents.
Thank you.
Alderwoman Tyus, are you still with us? Alderwoman Green.
No questions.
Alderwoman Martin.
No questions, but thank you.
Alderwoman Navarro.
Great. I don't have any questions. I appreciate all of the information that was sent over, and that definitely makes our job a lot easier. So thank you.
Alderwoman Middlebrook.
Thank you. I have no questions.
Alderwoman Rice.
Thank you. I just wanted to commend you, Jamie. The reports on your grantees and everything are really thorough and very clear. And thank you for presenting that information in a way that we can see directly where these services are going to.
Alderman Todd. Alderman Todd, you're muted. Let's see if I can unmute you. Oops. Looks like we're toggling here. So,
am I unmuted now?
You are, Alderman Todd.
Okay, first of all, I don't have any questions, but I would like to commend our guest for the being very plain and transparent in making her presentation. And thank you, Madam Chair, for bringing her on.
Thank you, Alderman Todd. And with that, I would agree. These documents are very easy to digest. They're very easy to go through. And so, and with that, I will entertain a motion to pass Resolution 16 out of the Health and Human Services Committee with a due pass recommendation.
So moved.
Second.
Previous roll.
Hearing no objections, Resolution 16 has passed out of the Health and Human Services Committee with a due pass recommendation. And with that, we are on to our final item on the budget, on the agenda today. This is Board Bill 27, and we have committee member and sponsor of the bill, Cristina Garmendia. Would you mind? I'll hand it over to you to present Board Bill 27.
Thank you, Madam Chair, members of the committee. Board Bill 27 is a board bill that addresses third-party delivery applications that a lot of us are used to using typically when we're feeling lazy, but due to COVID-19 has become, I think, increasingly popular. So we're talking about apps like Uber Eats, DoorDash, Instacart, Postmates, things of that nature. And subsequent to the restaurants in the 6th Ward shutting down, I ended up somehow non-qualified small business representative of about 200 small businesses. Brought this issue to my attention. Just wanted to thank the small businesses and restaurants in the city for bringing the issue of just some, I think, accountability and transparency that we can put in place so that restaurants are able to turn a profit, the platforms are able to turn a profit, and that we can ensure where our gratuity monies are going and that employees or contract workers for these apps are also being paid. And so this board bill is a work in progress. I am very grateful to Uber Eats, DoorDash, Instacart, and Postmates because they have provided me with red line changes and suggestions that I am still working on with feedback from restaurants as well. And so I can tell you that we're going to take off the inspection grades portion that the health department would implement. Those are already available online, and it was not something that I realized before drafting the bill. We're still working on language around fees, commissions, and gratuity. We will keep the requirement to have a business license. So The platforms themselves will have to get a business license, but not the contractors. Currently, Uber is the only organization that has a business license with the city of St. Louis. And then we will be creating an exemption for small businesses. I have Chris Miller with Uber Eats to testify today, and then Christian Eldridge with Taco Circus to represent restaurants. And so, Madam Chair, just depending on your preference, folks can ask questions of us individually, or we can all testify and then open it up to questions. Although it looks like the chair is missing from her chair. Christian, do you want to go ahead? Are you able to unmute yourself and testify?
Hello. Thanks for taking the time to look at this issue. I think that for a long time we, as restaurateurs, didn't really have any recourse personally. You know, through conversations over the past couple of years, we began to see what was going on, and over the long term, we began to realize just exactly how hurtful it was to have these rates. I think that what we're asking for is pretty clear cut. The industry standard on restaurant profits is at about 10%. And so what we're asking is that we split our 10% profit with the third party delivery companies. And that's why we're asking for a cap at 5%. And that includes things that in the fine print that you see, such as fraud prevention that can equal a large amount, or processing fees, even though we already have credit card processing. I think that a lot of the cost incurred by running an app such as Uber has been passed on to the small business, and it is very evident how harmful it is. The way that we are approached by the salespeople for these platforms, they'll offer you hardware and say a tagline such as, well, these are sales you wouldn't be getting otherwise, and we're bringing you new customers, which is framing the truth in a way that doesn't allow us to take a look at the fact that it's not profitable at all for restaurants. We don't get any of that customer information. We don't get to decide how it is marketed. In fact, you must pay an additional amount of fees if you want to be seen on these pages. And we don't know the consistency in which the food is delivered. None of these delivery drivers are actual employees. As y'all were stating about them being contract workers, it's exactly that. So the accountability is very low. I was finding situations where they would take on multiple accounts, pick up food in a certain area and go somewhere. So when the food would leave the restaurant, it wouldn't get there for a very long amount of time. Then you get into customer service issues where they're very hard to reach, being that they're simply an app and the customer service level is very low. And then they end up calling the restaurant when the food is out of the hands. Same thing with the navigation and usability of these sites. If it's not up to par, then it usually falls on the restaurant that they want to call or want to use and purchase food from. So like I said, it's pretty clear cut on our side as far as we have 10% profit. We're willing to share half of it. This is a national issue. And what we would be doing for ourselves is getting ourselves at the forefront of taking care of our own economy. And when our restaurants lose money, that means our economy loses money. And when the money goes to a national company, then it leaves our local economy. So by passing this, it would be a win-win for the restaurants, who many of them don't utilize this. So you're getting national restaurants that get cut better deals. I would venture to say if they were transparent enough about the fee structuring, that you would see a place like Wendy's have a very, very low fee structure in comparison to local St. Louis restaurants. So it's just another example of wealth trickling out of the city and going upwards, whereas we need to be reversing that model and helping this. By lowering that, there will be more usage of these companies, both by consumers who find it prohibitive and who are aware of these issues, and by the restaurants who do not utilize these services. And we're all starting to wake up to it. So you're seeing class action lawsuits in many cities, and you're seeing them putting caps on it. And as I said, if we did this for ourselves, then we would put ourselves at the forefront of a national issue and be getting out ahead of it. Like I said, I would like to see some more transparency on the way that these fee structures, because these salespeople are getting whatever that they can from any restaurant, without any discussion as the repercussions of profit loss towards us. I mean, it's essentially an app. There's no support system other than if you call a national clearinghouse of telecommunication, and a lot of it's fallen back on us. So besides the fact that this needs to be at 5%, there also needs to be some further regulation concerning how they're treating the contract workers, and making sure that they're not taking on multiple accounts and then the food suffering from there. Maybe even spot checks on how hot this food is coming out sometimes. I mean, when we're doing offsite, we're having to do a lot of meeting with health inspectors to make sure that the food is staying safe, and I don't see any regulation on that. So the 5% was the main thing, and then other than that, like things that go along with a disruptive new business model in the shaking out of fixing those things. I think that once we get it to that situation, then it'll be a very beneficial symbiotic relationship between local restaurants, national companies, and then helping this economy. But until then, it reminds me of the first internet bubble, where the advertising of a click on a website was worth 2 cents, 3 cents in the 90s. Then there was the shakeout. From that, where, well, that doesn't translate into a sale. Your visitation does not equal that a click would be this amount. So then the click on a website went down way low after that. I think it's probably 0.05 now for a click on something. But I say that to say the disruptive nature of the model, we need to have some regulation on it, and the restaurateurs need to be heard. And I think that it is a fair proposal that we split our profits with these national apps, who, as I said, don't even have actual employees in the city. They contract people, which has led to other problems. Thank you.
Thank you so much. I also have Chris Miller with Uber Eats on, who can testify on behalf of his platform.
Great.
Ready for me, Chair?
Thank you, Chris. Go ahead and introduce yourself for the committee if you don't mind.
Yeah, thank you, Chair Spencer. My name is Chris Miller. I'm the Senior Public Policy Manager for Uber, cover about 7 states in the South, including Missouri. Appreciate the time today to go through this important issue. You should have provided with you my written testimony. I'm going to kind of go through that, and as I go along, if there are questions, please just interrupt and ask. Uber Eats welcomes this conversation with Alderwoman Ingrassia and the Health and Youth Services of the St. Louis Board of Aldermen on the topic of food delivery platforms. As written, we have some serious concerns with Board Bill 27 and its 5% commission cap that would jeopardize St. Louis restaurants' ability to utilize food delivery networks like Uber Eats. Because of the growing complexity of the food delivery business, we appreciate this opportunity to explain the brief history of Uber Eats and how our business currently operates. Uber Eats serves customers in all 28 wards with delivery options from hundreds of restaurants, eateries, delis, and food establishments across St. Louis. One of the reasons we have been able to grow our business successfully in St. Louis is because we value our restaurant partners, and we demonstrate that through a quick and transparent onboarding process. When a restaurant or food establishment is interested in partnering with Uber Eats, a member of our team will walk the restaurant contact through the basic options included in our partnership, using their own delivery workers, using Uber Eats delivery people, or a combination of both. We'll also explain to them the difference between each option. Once the restaurant partner has determined which delivery method they prefer, we share them on a brief, plain language contract which outlines the cost, and upon agreement, get them up and running on our app as quickly as possible. We're committed to having no hidden fees for restaurants. We don't charge for credit card processing, and we don't charge higher rates for lead generation. Our model is straightforward and transparent from the beginning. Restaurants could choose to pay 15% fee for use of their own delivery workers or pay 30% fee for use of Uber Eats delivery people. Currently, we charge 0% for pickup orders. We do not charge any other fees to the restaurants. Restaurants can also choose to alternate between these options seamlessly. For example, if restaurants are using their own delivery staff and then it gets too busy, they can decide to tap into our delivery network at the touch of a button. They can then turn off this option and go back to lower commission when things slow down again. Many choose to have Uber Eats facilitate the delivery for them because it means not having to pay upfront for delivery workers by the hour all day to wait for orders to come in. They could choose to pay a bit more on the individual order to have Uber Eats facilitate the delivery only when the order comes in. This offering is more important now than ever because restaurants are cash strapped and many cannot afford to pay workers to be on call all day. With Uber Eats, they only pay for the delivery logistics when the order comes in. We provide our restaurant partners with the necessary hardware and software to manage their operations through data and have Eats experts on hand to troubleshoot any issues the partners experience in real time. We understand that the restaurants, small and large, are adapting to the changed landscape of food delivery across the city. And it's our goal at Uber Eats to make this process transparent and fair as possible so that they can continue to grow their customer base and prosper. We very much appreciate the opportunity to share this information with the committee and look forward to working with Alderwoman Ingrassia on Board Bill 27. I think one of the things I'd like to touch on here is its transparency and not commission caps. I agree with Christian that transparency is at the forefront. When a restaurant signs up with Uber, everything is written down and that fee is agreed to. It's signed by both parties. Plus the flexibility is such that at any point the restaurant can go offline and not use the service with no penalty cost. I think the options that are provided, 0% commission for a pickup order that can be utilized right now, 15% for their own customer, for their own delivery person, or 30% for us to incur all of the expense is pretty fair. One of the things we did do at the beginning of COVID is quickly to help restaurants we have a standard 1 week payout, and we changed that to an everyday payout to help the cash flow continue to move. So we look forward to this conversation. I think the important things from our standpoint is while you've seen a few other cities across the country look to address this issue, all of them include language in the bill that references during a state of emergency, which I think would be critically important for this bill, that regulations like this would only go into place during a state of emergency when patrons of the restaurant cannot actually dine in person, and there's an emphasis. We have proposed a bifurcated commission cap fee during this state of emergency for 15% for delivery and 5% for other fees, such as processing of credit cards and other financials. And like I said, we very much look forward to sitting down with the Alderwoman virtually and trying to come up with something that works for everyone. So if there are any questions at this time, I'd be happy to take them.
Okay, thank you, Chris. I want to thank both Chris and Christian for waiting through the first portion of our hearing. I know that it was a long time. We were going through those reports, so thank you for your patience here. I want to also point out that I'm not planning on entertaining a vote on this bill. Currently, I think we all have acknowledged that we have some work to do, but certainly hearing the perspectives of everyone here today has been very helpful in moving this forward. With that, I'd like to turn it over to my committee members to ask questions. And it's a little bit unconventional, but given the presentation here, I think, and given the late hour, I'd like to take questions of either Chris Miller, Christian Etheridge, or sponsor Ingrassia. Alderwoman Ingrassia, do you have anybody else that is available here to speak on the bill, or is it just those three, or just the three of you?
It's just the three of us.
Great. And with that, I'll start with you, Alderwoman Ingrassia, if you have any questions for yourself or your group.
I
Okay.
do have questions for myself, but I will ask them to myself.
Great. We'll let you do that privately.
Thank you.
Alderwoman Tyus.
Thank you. I guess for all of you all, have they, I'll ask Alderwoman Ingrassia, have they made suggestions to you about what they would like to see the changes?
Yes, I apologize. I didn't mean to cut you off. I have red line versions of the board bill from Uber Eats, DoorDash, and Instacart that I'm working through, and I'm continuing to have conversations with the reps of those organizations, and then also obtaining feedback from their suggested changes with restaurant owners. So I'm feeling confident that we can get to a place where everybody is mostly happy.
Okay, and so, and I was going for the first part of maybe, how did you come up with this bill? I mean, was there complaints from people, or do you order food a lot during this time, or what happened?
All of those things happened. So I have been in close contact with 6 ward small businesses and a number of other restaurants folks from the beginning of the COVID crisis to date. And then was watching what was happening nationally. There's a number of other cities who have tried to address this. And so I looked at legislation from all over the place, or emergency orders from all over the place, and then drafted this one myself. But yeah, also I do admittedly use these apps way more often than I should.
The joke in North St. Louis has been, well, the rest of the city knows how North St. Louis feels now, because we do not have sit-down restaurants. So that was not a problem for us. That has been one of the things that I have been nagging about forever. So this is the few I have the most fast food restaurants in all of North St. Louis, and they just closed down their dining rooms and carried on as usual. So they didn't have as many problems. But I really like in your bill about posting what the grade is. I still find sometimes restaurants don't have their grade level posted. And I think that the Health Commission needs to step up their game about making sure that that is something that you see. When I was growing up, that was the first thing you looked for when you went into a restaurant. So I think that's great. I don't have any.
Pardon me for the interruption. On a side note, we are forming a nonprofit for management training in order to erect restaurants and food deserts, and then turn over the ownership of the restaurant to the management after they've gone through management training. And that was something that had come up through the issue of COVID and our discussions with the food desert. So that was just a side note that that we will be back on discussions concerning that. And if y'all have any leads concerning any civil agencies that might assist us on that, Sean Baltzell and the rest of his organization, we've been working on that among other things. Anyhow, pardon the interruption.
Okay, thank you. I actually don't have a food desert because when I was the 24th Ward alderperson, I actually built a grocery store and did a lot of other things. So I'm one of the only places in North St. Louis that does not have a food desert. What we have is an abundance of fast food, which is just as bad for health. And I started to oppose those fast foods because we have more than enough. Okay, and we have diabetes, high blood pressure, and all those things. So I try not to go there much. But
I certainly agree with the issues of education starting right at nutrition.
But I do say that I read the bill. I agree with much of what they're trying to do. I'm glad you're working together. So I was wrapping up to say I don't have any other questions, and I hope you're able to work out something. But a lot of what they have in here, I do agree with. So, but I'm not as knowledgeable as you and the other person. So I'm looking forward to see what you come up with that can be collaborative, that it fits everybody's idea of what a good board bill will be. Madam Chair, I don't have any.
Thank you, Alderwoman Tyus. Alderwoman Green.
Yes, thank you. And thank you, Alderwoman Ingrassia, for working on this. As you know, I represent a good number of restaurants in the South Grand Business District and in the Morgan Ford Business District. And throughout COVID in particular was hearing that, you know, these delivery fees are just killing us, and if we don't participate in it, it puts us at a competitive disadvantage when our doors can't be open in the way that they would right now. And so a lot of our restaurants have felt kind of stuck between a rock and a hard spot on how to continue to operate and how to be competitive in this. So I do have a couple of questions for Christian. First and foremost, are you currently using any of these apps, or have you used them in the past? And what did that look like?
I did use them in the past. The first couple of years of my restaurant, I've owned a restaurant for 6 years now. The first 4 years I was in Bevo Mill, Dutchtown area, and I had a couple of very hard winters, and so I decided to try them, and the revenue was coming in, but there were no profits, and so I stopped using them, and then I ended up going door to door myself during those first couple of winters, and rubber banding menus on the rails, and getting the calls on my phone, and running back to my car and going and making the food, and then going back and delivering it, just because I was losing money with those. As I said, a lot of it will be, you know, well, you're going to get these other sales that you didn't have any leads on, but it's a loss in profit if you're at 30%. If you're at 30% and you only have 10% profit, that means that you're losing 20%. A loss of 20% on every single sale, and that leaves our economy. And so no, I do not use them. I think that some of the things that the gentleman from Uber had brought up regarding the ease of service of no fees on pickup orders, that's not what we're addressing at all. We're addressing the fees on a delivery service. Might I add, I would like to see what kind of insurance rates they're paying for these contractors, if any. You know, just a reminder on the fact that these are people who are not employed by this company, but contracting themselves and paying taxes on this. So a lot of the cost incurred for their business model is being placed on the customer, who incurs additional fees, the contractors who don't know what they're getting into, and then the restaurants who are brought in by the allure of having an additional revenue stream, which ends up being at a loss. So no, I don't use them, and more people are ditching them. And what you're going to see is more and more fast food places on those third-party delivery systems in less and less local places once they start to see their numbers on it. And this is a result of all of us getting together and saying, hey, we'll split our profits with you, and that's a fair deal.
And then a couple of questions for Chris Miller from Uber. Can you walk us through just a couple of things? First and foremost, what are your for this last fiscal quarter? Can you tell us what your profits were as a corporation during the first fiscal quarter of this year? Would have ended, I guess, May 31st.
I don't know the answer to that, but I think the answer is zero. I mean, we've been very publicized as not being a profitable company yet. I can double check and get that information, but I don't know.
So then my follow-up question would be, if your profits are zero, what is the compensation of your highest paid employees?
I have no idea.
Okay. I think, can you tell us what the average compensation is for your independent contractors that you hire?
I think that would depend on each market, as rates are different in each market, but I think that's a good point. The independent contractors we're working with are folks in the St. Louis community that get a lot of this money that goes to, and if you're capping the commission on that, that's less money we can pay for them. And that's something we pay for out of our 30% is that cost. And as the gentleman Christian just mentioned, he stopped doing food delivery because it was so expensive. It's not a cheap endeavor. And that's where these funds go. And I think, again, the biggest thing as we look at this issue, especially during COVID, is transparency. I understand Christian's frustration with the lack of transparency. And so I think there should be, if you're looking at this issue, parameters around transparency. At the end of the day, it's Christian's prerogative and other restaurant owners' prerogative whether or not they use this service. And we make it very easy to go on and offline with no penalties or fees. And as Christian pointed out, he chooses not to use this service. I think the other thing to keep in mind is that there are many restaurants that are very happy with this service in the way it is right now and have seen growth in business and like it. So again, I think we should just leave the option with the restaurants at the end of the day, whether or not to use a service like this or whether or not to use their own delivery.
So I represent quite a few people that are part of the gig economy, who are workers who work for a number of these apps. And what I often hear from folks is that, there can be days when they're not making minimum wage. And I think that's really concerning. And I think it's concerning when, you do a quick Google search and there's a ton of information out there in media stories about the record profits that app companies are making during COVID in particular. And so if the company is making zero profits, as you say, I would have to think that there must be pretty large compensation going to people at corporate headquarters and not necessarily going to the workers that are in our communities who are doing this work. So I would really, for my end, I would appreciate if we were provided documentation that gave us a better understanding of what your compensation structure looks like, both for corporate and for employees or your contract employees within the city of St. Louis, because major app companies like Uber are definitely going to have more access to capital and resources than small businesses and independent contractors in St. Louis. And I think for us to understand better what a fair cap looks like, we need to understand the compensation and profit structure of these apps, the way that we're hearing from the our local businesses about what their cash flow looks like.
Yeah, and I'll try to get some information. I'm sorry, I don't have that on hand, but I think you raise a good point. If with a 5% commission cap, let's say it's a $50 order, that leaves us $2.50 to pay the driver, to pay the courier, to pay all of the other things. And so they go hand in hand. So if you're capping the commission, whereas we're paying for the delivery drivers and partners, as well as the other services that Christian pointed out, that's an issue. And then I think ultimately what you see is someone has to pay for that service. Otherwise, like Christian said, we can't operate a business at a loss. And so that's where you see fees go on top of end-use customers to make up that difference.
There are different types of fees. So there's your commission, but then there's also, what is the name of it? Sorry, I closed the app on my phone. That you have your commission rates, but you also have your delivery fees. And I know I also, if I order, I tip, you know, in addition to that. So how does that, when there are these different fees that are associated with the app, can you walk us through what each one of those fees are and what each one of those fees funds or goes to?
Right. So I think what's important is we're different than other food delivery companies, as our fees with the restaurant are all in the 30% contract that we sign. So there are no hidden or additional fees for them. We do charge a delivery fee for the customer. And then, as you pointed out, tips, 100% of the tips go to the drivers.
And does the delivery fee go to the driver, or does that go to the?
That goes to the company.
The company.
Yes.
Okay. So are drivers only getting tips, or?
No. Drivers are paid a rate for time and distance, just like similar to the standard Uber trip.
Okay.
And then, like I said, 100% of the tips go to them. And I will say, just in general, the issues with contractors, the number one thing we hear from both our courier and driver partners is flexibility. Most of the folks that drive for Uber and do courier service for Uber Eats are folks that have full-time jobs that are using this to get ahead and appreciate the flexibility and the ability to earn on their schedule and have work fit into their schedule and not the other way around. They're on no set schedules. They don't have to work. They cannot be on the platform for weeks, months at a time, and have an incurred expense come up. And as long as their registration and background checks and everything's in order, can go online and earn an extra compensation, which stays in St. Louis.
One final question. In some other cities, delivery drivers, app drivers are unionizing. Do you have a position on supporting the unionization of workers in our St. Louis community? And if that were something that were to happen, could we count on your support?
We don't have any employees in St. Louis. We have are you speaking to our contractor?
Contractors, because they are essentially employees. They're just not. Their app companies are taking advantage of tax codes that allow them to put people as independent contractors rather than employees, which saves you money as a big corporation.
Again, I would tell you, we constantly talk to our driver partners and couriers, and the number one thing we hear back from them is the flexibility that comes with being a contractor. Many folks are contractors. It's the future of work around your schedule, being in your own boss. And that's the number one thing we hear back. And again, most of our folks have, quote, full-time jobs, and it's using this as an opportunity to supplement their income. And so that's in where we are. And I do not believe any of our drivers or couriers are unionized.
Okay, thank you. That's it.
Okay, thank you, Alderwoman Green. Alderwoman Martin, still on the line?
No questions at this time. Thank you.
Alderwoman Navarro.
Thank you. I do have a few questions. The first one might be for Alderwoman Ingrassia. Do you know, is this being considered in the county as well? I've heard back from businesses in the 28th Ward, and that's one of the issues that has come up, is that if this passes in the city and not in the county, especially if it would cause any of the third-party delivery services to not deliver in the city, and they've got multiple locations, that would have an impact on their business and could be confusing. So I'm curious if there are efforts in the county along these lines.
Yes, I've been talking with County Councilwoman Lisa Clancy and a handful of municipalities as well.
Great, thank you. Another concern I have, and maybe this is for for Chris Miller, if, well, or maybe anybody can answer this if we've seen this happen anywhere else, but if there is a cap on delivery fees, I guess the concern would be that, you know, maybe that would just get shifted into some other, redefined as a different type of fee. And so I don't know if anybody, again, I don't necessarily know who that question is for, but has that happened before, or, you know, how would you anticipate handling that?
I could say, I think Jersey City implemented a 10% commission cap, and I believe in order to continue to operate there, we're assessing an additional $5 surcharge on the end-use customer.
Okay, thank you. And then this question would be for Christian Etheridge. I'm familiar with these services mostly as somebody who, you know, orders out, not on the business side, and I'm just curious, you know, kind of what you see as the incentive to use the third party over just doing it yourself. I mean, as I'm listening, I'm thinking if there's so many issues and it's so expensive to use one of these third party companies, why not just do? And actually I like that. I sometimes get frustrated with the various website apps and stuff, and I'm like, I just want to call the restaurant and they're going to send their person over.
First, I have a question that leads to this. Does Uber pay for the insurance of these contract workers?
We have a blanket insurance, just like Uber trips. We have a blanket insurance policy that covers the delivery.
Is that just a liability for y'all, or does that actually cover the workers?
It covers any accidents that will occur when they would be on a trip.
The reason why I ask is the main I would like to see how that insurance policy is structured, because one of the main prohibitive costs of doing in-house delivery is an insurance policy of your employees, of which they have none in St. Louis, of us insuring our own employees in order to leave the premises, and the other risks inherent with delivering food. That also the startup cost of marketing it, and vehicles, should we choose to purchase our own vehicles. I would also be interested to see, as to the reasons why these companies are not profitable at this point. And I would venture to wager that it is due to the immense amount of market capitalization and merging of these apps and this software. These are incredibly well-funded businesses that definitely have a timeline in order to become profitable. So when we're talking about large national apps not being profitable, that is part of their timeline as to how they grow. I believe a lot of this money is being spent on search engine optimization and cutting each other off, and we'll begin to see more and more of the merging of these companies. So as far as bringing up the point of, well, if we only get this amount of profit off of this sale, he brought up $50, they would only get $2.50. I would like to remind that the restaurant also would only get that amount. That the restaurant that has a brick and mortar and employees to pay here also gets that amount. And quite frankly, welcome to the restaurant industry. We're willing to split our profits with y'all. 30% is an exorbitant amount, and they're using small restaurants and unwitting participants to subsidize their business model while they continue to merge and get larger with their funding. It's not okay.
Great, thank you. I don't have any further questions.
Okay, thank you, Alderwoman Navarro. Alderwoman Middlebrook.
Thank you. I have no questions.
Thank you. Alderwoman Rice.
Thank you. I'm very interested in this bill, and also very thankful, Christian, for Taco Circus coming into the 8th Ward. I hope that you're feeling very welcome here and can't wait to get back on your patio. I'm very concerned about the business licenses, and so Alderwoman Ingrassia, thank you for including that in the bill, that anyone who's operating in the city of St. Louis should hold a business license for the city. And I don't know that I have. Well, I know that we were reached out to, I believe, by the Food Peddler, which is another local delivery service, and I think, and I'm not sure how the bill would affect, a more local delivery company versus, a larger app, larger company like Uber Eats or Grubhub. But I think that their voice is important at the table since they are local and, serve our city with, their base here, they have employees here and all of that as well. So I know you're listening as well. And so thank you for that. And
yeah, just Alderwoman Rice, just so you know, in the committee substitute I'm working on, that business would be exempted.
Okay.
I didn't even know that we still had any bicycle delivery local businesses on the ground in the city, or I would have probably thought of it before I drafted the original bill, but that will be a change that I make.
Great. Awesome. And then the other, I share Alderwoman Green's concerns about employees versus contract workers. I don't want to go down too far of a political road, but I've been a contract worker and it's awful. And so I really, truly hope that is not the future of work. But that is a whole different topic there. So thank you for the bill and thank you for the thoughtful consideration, bringing folks together as we look to new technology and new legislation to protect the city, protect restaurants and new companies that are starting up that are beneficial for our residents. So thank you.
Thank you, Alderwoman Rice. Alderman Todd.
I don't have any questions. Thank you, Madam Chair.
Okay, and with that, Alderwoman Ingrassia, did you have any closing remarks?
Sure, just very briefly, I appreciate the committee's questions and comments. I think it'll help make the bill stronger. I've talked to a lot of restaurant owners and even small business owners that are working in areas like retail right now. And every single person that I've spoken to says they would love to be able to use apps like this, especially during the crisis, but they're either breaking even or losing money. I haven't talked to anybody that said that they're turning a profit. And during a typical situation where we're not under rules and restrictions of the pandemic, it made sense in their business model, but just does not any longer. And so I really hope that we're able to come to a place where the applications realize that they will probably see a significant increase in the number of businesses that use them if they have more reasonable fees and commissions associated with that. And I will look forward to bringing back a committee substitute before all of you within the next week or so.
Thank you so much, Alderwoman Ingrassia. I'd like to add, just in follow-up here. So we've talked about, Mr. Miller, you mentioned some comparisons to other cities. If you could provide some, if we could look more broadly at what's happening nationally, I think that would be very helpful. Alderwoman Ingrassia could probably provide some of that insight. And then kind of a summary of where we are regionally. I know the county has some jurisdiction on unincorporated St. Louis, but I'm a little bit confused about the municipalities and where that would fall in, just to address Alderwoman Navarro's concerns there about having some consistency across our region. And as we move forward, please feel free to keep the committee involved. And if we can be helpful in making sure that we have a workable solution when we come back before the committee, we can be a resource in that regard. And with that, it's 1 o'clock. So unless I have any other questions from the committee, thank you all for joining in this long hearing today. Although it was 2 hours long, I think we covered some incredibly important ground here, and we made some important commitments as a committee to continue in looking into those reports that have been sitting on shelves and renewing commitments, making commitments to move forward with policies that improve the health and racial equity of residents of the city of St. Louis. Seeing no questions from the committee, I'll entertain a motion to adjourn.
Move to adjourn.
Second?
Second.
Hearing no objections, the Health and Human Services Committee is now considered adjourned.